And I'm making note of that, of possible query opportunities. Hey guys, it's Noreen, and thank you for making it to my channel, All Things Noreen, where I talk about lifestyle and nursing. And today I just wanted to do a quick going through a chart, or what it's like going through a chart, so you guys have an idea of what it's like. So typically, so I have my two monitors. I will do show you guys my work desk setup. Obviously I cannot show you the monitors because of HIPAA, but yeah, so I have two monitors. I have Epic open in one, and then I have my 3M Solventum open in another. It basically pulls the doctor's notes. So I'm going through both. So typically how I go through a chart is, first I'll start in Epic. I get my patient's BMI, weight. That's very important. And then I also, after that, I will check the skin for any pressure injuries. Then after that, I go look at the patient's home medications. So I kind of know what's their normal meds. And then after that, I'll go through the vitals. So you're going through their vitals from the time they're admitted. So I see with this patient, her vitals are fine. She ended up coming for a TVAR. So her vitals were fine. Then she went to surgery. Then after surgery, just from going through doing my chart review, her vitals were fine after surgery. Then I did notice that she did have some high blood pressure, so they did have to put her on nicardipine. So that right there, you can send a query for hypertensive urgency or emergency, depending if there's any organ failure or anything like that. Then I see that she's on nasal cannula after her procedure. So when she was admitted, she was not on nasal cannula. So if a patient is on nasal cannula or any O2 48 hours after surgery, you can send a query for post-op pulmonary insufficiency. And so then I do see that she does get to tachypnic at one point. Respirations running 23, 24, very consistent. And then so this is things that I'm looking at as I'm going through the chart. Then I see she did desat 89%. So yeah, since it was after surgery, I'm gonna send a query for acute post-op pulmonary insufficiency. If there was no surgery and she just started her O2s were dropping, it would be acute respiratory failure. And then I see she has a fever, so I'm gonna see if there's any infection going on. Can possibly be sepsis, because now we have she's also tachycardic. Then we have the tachypnea. So those are things you want to look for, right? So then after that, and I'm making note of that, of possible query opportunities. Then after that, I go to the MAR. I am looking at all the meds that they had to give, like the new stuff that's not like her home med. So I see she's on some antibiotics. We did see she had a fever, so I'm going to see there's an infection. And then she did get some Atrovent, so there is some respiratory stuff going on. Then I see she had to get some potassium, some sodium phos, so some electrolyte stuff going on. Cefazolin, that was most likely from the surgery. Some Keppra, so I need to see what's going on, if she's having new seizures or what is this original. Then I go to the labs and it checks. Okay, I saw she was getting potassium. I see her potassium is low, so that's a possible query for hypokalemia if necessary. Her creat is good, her glucose is good. Let's see, then you want to check like she's hypocal, hypophos, hypomag. So we have a lot of electrolyte imbalances. That's usually pretty common with the surgical patients. Then I want to check her WBCs. Her WBCs are not elevated, so maybe it's not an infection. We don't know. We're gonna have to see. Her hemoglobin, hematocrit's good. Her platelets, 140s. A little thrombocytopenia there, nothing too crazy to worry about. She did have surgery, so I will check her EBL. I will check if she needed to get any blood. Then they also did a UA. Doesn't look too crazy. They didn't do a urine culture, so they're not concerned about any UTI or anything like that. They did do a blood culture, but there's no growth. And so really quickly, I'm gonna check to see if she got any blood. Nope, no blood. So that's me going through Epic. I'm also documenting everything in my Word document, in my template. And then when I go to my 3M Solventum, that's another on my other monitor, I'm going through the H&P, I'm going through the consult notes, I'm going through the progress notes. Also, so I see, so she was originally in surgical ICU. Then it seems like she transferred to the floor, and then some neuro stuff happened. So they sent her to neuro ICU. I have ICU background, so I do the ICU floor. So I do surgical ICU and neuro ICU. So I know those doctors and how those work. So as I was doing that, I also noticed that she did have some confusion. So when you do have some new onset of confusion, that's more than likely you can send a query for encephalopathy. So it's just a matter of figuring out what is the cause of the encephalopathy. Is it metabolic? Is it due to a stroke? Like, what's going on? So I'm gonna look into that. So now, so I have a couple things. I have the hypertensive urgency, emergency. I have the acute post-op pulmonary insufficiency. I have the encephalopathy. Which those I usually do a lot. A lot of those you will see in the ICU. So there are notes from vascular surgery because they're the ones who did the surgery. And then also you look at the PT, OT notes, speech, SLP, registered dietitian, you're looking at that. You're looking for malnutrition from the dietitian. Any signs of malnutrition, you want to send a query. From the SLP, typically you want to see if they have any form of dysphagia. Because if they say it but the doctor doesn't say it, you will send a query to the doctor. You're sending the queries to the doctors to capture these diagnoses. And then I'm also going through the op note, procedure notes to see if there's anything in there that I can do. Like, so she had the TVAR. Then after that, I'm looking at the radiology notes. Like, this patient had ultrasound bilateral lower extremities. She had a CTA done, MRI done, chest x-ray done. It looks like they found an acute lacunar infarct. So that's probably going to be the reason for her encephalopathy. So I will query for encephalopathy due to infarct. And, yeah, so basically you go through the chart, and then while I'm going through the chart in the 3M Solventum, I'm literally coding those diagnoses. I'm putting those diagnoses into the 3M. That I cannot show you, that's HIPAA. But yeah, so I'm doing all that, saving my diagnosis. And then after I do that, I'm going to go draft up my queries, send my queries, add my notes into my add findings in the 3M, and then I'll be done with that chart, right? So it really depends how you move. Me, I have like a really short attention span, so sometimes it takes me a little bit longer than normal, but everyone is different. So, but like if you're like, you could lock in, which is what I typically try to do. I just try to lock in, knock everything out so that I'm not in a chart for too long. That's really more ideal. So yeah, that's what it's like going through a chart, okay? So if you guys have any questions, go ahead and ask me. I'm about to draft up these queries. All right, y'all, so really quickly, other thing I wanted to say was for this patient has history of COPD and OSA, obstructive sleep apnea. Typically with those patients, it's usually you're gonna see they're gonna have some complications post-op. They're more than likely going to have the acute post-op pulmonary insufficiency. So even when I'm putting in my query, I'm going to put as an answer option acute post-operative pulmonary insufficiency expected. Patient has history of COPD and OSA. And so these are things that you learn along the way. It seems like a lot, but it's really not, like, once you get the gist of it. And then if you guys want like more practice and stuff like that, I do have resources with like scenarios similar to this where you can kind of go through it and try to come up with what you would query with. So definitely check that out. And then the other thing is too is that the doctor said hypertensive emergency. So but I'm not sure if it's emergency or urgency, so I'm gonna go through to see if there's an organ failure. If there's an organ failure, then emergency would be appropriate, but if not, then I would have to send the query and ask for hypertensive urgency instead of emergency. So that's just something else I wanted to let you guys know. So yeah, if you guys have any questions, let me know. So the other thing that I wanted to say was that, so since I did catch that, I'm not sure if it's emergency or urgency because it looks like the patient got confused after the nicardipine. So it might be urgency, not emergency, but I'm just going to make a note of that to go back to it. But for now, I'm just going to focus on capturing the acute post-op pulmonary insufficiency because it is an MCC. And I'm also going to try to capture that encephalopathy today because that too is an MCC. I think it's an MCC. I'm not 100% sure. But that's the priority for right now. And then, no, other encephalopathy is CC. And so, I'm going to prioritize that now, make a note of it, and then go through that hypertensive emergency situation tomorrow. So yeah. Okay, so I drafted up my 2 queries and I sent them to the doctor. So I actually sent mine to the ICU doctor and the neuro ICU doctors to see whoever answers first. I try to send it to more than one doctor so that so it can be answered quickly. So I did send those two queries, and then I'll follow up with that hypertensive emergency urgency one tomorrow. And yeah, so that's what it's like, kind of going through a chart. There is like a whole lot more to it, but that's just like a brief to get the gist and idea of exactly what it is that you do as a CDI. So if you guys have any questions, go ahead and let me know. If you guys enjoyed this video, make sure you guys comment, like, and subscribe, and I will like share more stuff with you guys along my CDI journey. So today I'm gonna show you guys, or go through with you guys, another chart review. So this patient is a diabetic patient that came with a foot infection, status post an infection, status post a foot amputation a few weeks ago. So what I noticed is that the ED doctor said that the patient has diabetes type 1, but the internal medicine doctor said the patient has diabetes type 2. So that is something I'm going to have to query about. That's going to be conflicting documentation. I'm going to ask the doctor which diabetes is it, because it does affect which codes I will be using. And then going through the notes, I see ID seeing the patient, podiatry seeing the patient. A diabetic educator went through it, saw the patient as well. I also noticed that, so in the chart they said the patient is morbid obese. Morbid obese is BMI greater than 40. The BMI is 34.4. So I'm going to have to send a query to the doctor for that to rule out the morbid obese and get the correct obesity, which is going to be obesity class 1, which is BMI 30 to 35. So those are a few things that I noticed in this chart. Okay, so for this chart, I see that the doctor also said sepsis, so I'm going to have to go back and make sure that the patient actually has sepsis, because sometimes doctors will say sepsis and the patient doesn't have sepsis. But I will say that it does look like she probably does have sepsis, because she does have a fever, she is tachycardic, there is some tachypnea, she does have a foot infection. I also saw elevated procal. So I definitely think she does have sepsis. So that's something you want to do. Podiatry also saw the patient. They're going to do an IND and bone biopsy of her foot. And yeah, that's what this chart is looking like. I'm also going to look for to see what was her EBL, because I also think she has acute blood loss anemia. If there's a drop in your hemoglobin of 2 points, like if a patient came in with a hemoglobin of 12 and then after surgery went down to 10, like there has to be like a reasoning for the bleeding. You can query for acute blood loss anemia. So I'm going to look into that, and yeah. All right, so let me tell you how, like, sometimes it gets a little tricky, because so this patient, they had surgery, they had left for IND, but it says that the EBL was minimal, but their hemoglobin when they came in was 11.3, then it dropped to 8.0. And then I check if they got any fluids. She only got 500 of LR, 500 mLs of LR. So, but that's still, so it's not like her hemoglobin's diluted. It's so, you get what I'm saying? So if they're saying the EBL was minimum, she only got 500 ml. She went from 11.3 to 8. It looks like acute blood loss anemia. She had surgery. They probably underestimated how much blood she lost. So then it gets kind of finicky if I should, if I shouldn't. But it's better to query than to not query. So I'm going to query for acute blood loss anemia. And then also so they said the patient has osteomyelitis, but then the x-ray showed that no acute osteomyelitis. So the x-ray shows no acute osteomyelitis, but the op note says other acute osteomyelitis. So then it's like, okay, well, is it osteomyelitis or not? So typically you want to code what's in the op note. That kind of weighs heavy, because that shows that's what the patient came for and what they have treated. So I'm going to code the osteomyelitis, but I am going to put a note to like figure out what does this x-ray say, no acute osteomyelitis. So that's like another thing, like there's like things you just kind of have to figure out along the way. So yeah, so now I'm just going to draft up these queries. Well, I already did 2 of them. I'm going to draft up the acute blood loss one, and then I'm going to send it to the doctor. So if you guys have any questions, let me know. If you guys found this video helpful, don't forget to comment, like, and subscribe. Thank you guys for watching.